Hi, my name is Caitlin Fogal, and I will be presenting a community analysis focusing on Flint, Michigan. First, there will be a brief overview of the history and evolution of the city, followed by a complete analysis of the community. This presentation will then focus on a prioritized list of 6 community health-focused issues. Flint was founded as a trading post in 1819, which led the way to Flint becoming a center for lumbering and agriculture. The plentiful resources aided in the development of the Durant-Dordt Carriage Company. Suppliers for the carriage industry became suppliers for Buick Motor Company, which came to Flint from Detroit in 1903. In 1908, General Motors was created. Being home to the largest GM plant, Flint's economy was booming and the city was successful. But in the 1980s, many GM plants were relocated or closed, which left Flint devastated both socially and economically. The city has yet to recover from this downfall. The city of Flint is the urban core of Genesee County. The area is served by 3 hospital systems who partnered with the Greater Flint Health Coalition to complete a community health needs assessment. They found 10 priority health needs, as seen here. To be able to better understand why these are prioritized the way that they are, I will provide some demographic information along with structural issues. The number 1 need found was clean and safe water access. The widely publicized Flint water crisis began in 2014 when, in a bid to reduce the expenditures of the water budget, the city switched their water source from Detroit to the Flint River. Lack of proper water treatment by the state led to eroding iron water mains, coloring the water brown. In addition to that, half of the service lines in Flint are made up of lead, and the improperly treated water allowed that lead to leach into the water supply. Class action lawsuits were filed and publicly attacked by government officials. Concerns and findings were denounced as false, even though the EPA and Virginia Tech found lead levels as high as 13,200 parts per billion in Flint tap water. The EPA classifies water with higher than 5,000 parts per billion as hazardous waste. Criminal charges were filed against government employees, and several state officials have been charged with involuntary manslaughter. The city was then ordered to distribute water filters and supply bottled water, but their efforts were widely criticized as the filters were in short supply, and those that were provided did not effectively filter lead. The second highest need found in the community relates to infant and child health. 62% of children in Flint live below the federal poverty level, and the teen birth rate in Genesee County is 44.3%. Children born to teens are more likely to have poorer educational, behavioral, and health outcomes throughout their life. The number of child abuse and neglect victims is over 21 per 1,000 children. While a decrease in infant mortality was seen in 2010, shortly thereafter the targeted initiatives disappeared, leading to an increase in infant death. With high poverty levels and lack of initiatives for the community, little is being done that is effective in decreasing the infant mortality rate. The third highest need found in the community was improvement needed in healthy lifestyles. The county's obesity and overweight rate is over 70%. The physical environment of Flint offers little access to safe physical activity. The county also has a 28% smoking rate. Few resources exist to aid residents in smoking cessation or to even educate them on the importance of quitting. The next prioritized need is effective care for an aging population. The median age of the population has increased almost 14%, and those aged 55 and older are disproportionately higher than the total population. The aging of the community increases the need for already overworked and underfunded social supports and healthcare services. Data also shows that advance directives are only present in about a quarter of the population. Services. Newer jobs brought to the area do not offer sustainable wages. Number 8 is food insecurity. 43% of households receive food assistance. There is only one chain grocery store, which severely impedes residents' ability to get healthy, affordable food. Many homes also do not have vehicles to travel outside of the city for groceries. It's hard to entice grocery chains to come to Flint, with high crime rates and severe blight. Number 9 is healthcare access. Issues in Flint include aging out of physicians and healthcare providers, as well as a provider shortage, with a high rate of public health insurance. That change of payer impacts providers' willingness to practice in the area because they receive a lower reimbursement. Another issue is lack of education for Medicaid expansion programs and how residents can use those benefits. The final need is community safety. The violent crime rate in Flint is exponentially higher than the surrounding areas, at almost 2,100 violent crimes per 100,000 people. This high crime rate affects a resident's ability to safely participate in physical activities outside of their homes, drives businesses away, and overwhelms the city's already lacking law enforcement. Poor city management has led to overspending and misspending of funds. This has created budget deficits, which cause cuts to public health programs. The Flint water crisis overwhelmed the community financially. Residents refused to pay their astronomical bills for their unsafe water, and many experienced foreclosure. Law enforcement saw significant budget cuts, and emergency response times for level 1 responses can top 45 minutes. With many abandoned properties, lack of law enforcement availability, and no budget to cover any increase, the structure of Flint requires a serious overhaul. Multiple population issues were found. There has been a consistent yearly decrease in population, which is now under 100,000 people. This will affect the city's ability to apply for certain grants and income resources. The universities present within the city can falsely inflate the population, as many of these students will no longer be residents once their education is complete. There is also a lower population of males aged 30 to 34 and aged 40 to 44 due to incarceration. There is also a low amount of educated people within the population. Flint suffers in many areas, and key factors are the high crime rate and lack of public access and education. Here I have done a comparison between the community in Flint with another similar community, the city of Detroit. Detroit shares many similar demographics with Flint. Detroit's top problem areas included access to health care, mental health, and social determinants of health. Some of their top community health issues were similar to Flint, as smoking, diet intake, and infant mortality. Literature states the biggest issue in Detroit is poverty. Poverty and illiteracy are commonly associated with poor health. Like Flint, lack of well-paying jobs in Detroit leads to a higher crime rate, driving healthcare facilities and businesses out of the area. The health resources analysis demonstrates a conflicting situation in Flint. There appears to be many community resources, but they're either underused or limited in funding. Access to resources is acceptable with numerous locations in the community and public transit available for those who need it. Affordability varies, but the vast majority of resources are targeted toward low-income families. I've selected 3 specific community objectives applicable to the health of the Flint community by utilizing Healthy People 2020. The first objective I selected is to reduce the proportion of persons who are unable to obtain or delay in obtaining necessary medical care, dental care, or prescription medications. I selected this because delays can make residents feel their issues are unimportant and can reduce actual follow-through on those medical issues. Lack of ability to obtain care, including preventive medicine, can severely affect one's ability to live safely and function productively. Overall well-being is a key factor in living a quality life. The second objective I selected is to reduce the rate of fetal and infant deaths. The mortality rate for infants up to 1 year of age in Flint is much higher than other areas. There are many reasons for this, including lack of access to care, lack of proper parenting education, lack of social support, and lack of stable family housing and food resources. Our children are our future. Reducing mortality in children is key. The third objective I selected is to reduce household food insecurity, and in doing so, reduce hunger. It is my belief that no person should go hungry. Families should not have to wonder how they will feed their children, and no person should go without healthy dining options on any budget. Poor diet can lead to learning issues, health issues, mental well-being issues, and increased stress. Pertinent community issues in the environment include the water supply and the presence of lead in both water and the older homes that most inhabitants occupy within the city. Resources provided are inadequate at best and endangering the public at worst. The water supply crisis is ongoing, with many still unable to safely drink, bathe in, or cook with their water. Many of the homes in Flint are older, with lead paint present. There is no opportunity for funding for families to invest in removal and replacement of lead paint, and the water crisis is far from over. Sewage disposal and hazardous waste appears to not be a major issue in the city. The Flint community is highly distrusting of their government officials. The water crisis brought many indictments and charges for criminal activity. The severe misuse of city funds led to an emergency manager appointment, which in turn, city residents saw astronomical rises in water and sewer rates, property taxes and millages, pay decreases, and reduction in public safety positions in an attempt to fix budget issues. In the most recent election, many council people were overthrown and new faces voted into their positions, demonstrating a desire for change from the city's population. Here I have listed my prioritized selection of community problems from the perspective of a community health nurse. The first need is access to clean and safe water, which is necessary for life. Here in the US, it amazes me we still have people who do not have clean running water. It's fundamental in public health. It is one of the largest issues Flint is facing. The second need listed is community safety. Residents cannot fully engage and want to invest in their city when they're afraid to go outside or to let their children play. They cannot seek physical activity outdoors or walk in their own neighborhood without fear. Third is mental health care. Mental health is largely overlooked by many. Part of being healthy and having general well-being includes having a healthy mind. Public health nursing involves caring for the person holistically, and we cannot underestimate the power of a healthy mind in overcoming barriers. Next, I have chosen infant and child health. Our children are our future. We must invest in taking the time, resources, and funding necessary to educate our youth, provide parenting support, and decrease the amount of children experiencing abuse and neglect. Number 5 is substance abuse. Firsthand, I have seen the devastation of addiction in the Flint community. Substance abuse contributes to high numbers of incarceration, child deaths, and high crime rate. Finally, adequate employment opportunity. Without opportunities for residents to empower themselves and work toward a better future, how can we expect this financially depressed economy to grow? Without opportunity for work with livable wages, we cannot expect people to rely less on public assistance for their daily needs.